Welcome back. Now let's talk
Health.
mission to Nigeria. Let's talk health. AMPA, which stands for the Association of Nigerian Physicians in the Americas, ANPA. Now, this association was incorporated in 1999, and it was incorporated for educational, scientific, and charitable purposes as a tax-exempt non-profit organization under Section 501c3 of the Internal Revenue Code. So, we have doctors from the United States, from Canada, from the Caribbean, who are Nigerians, and others who have sympathy for this cause coming together to make sure that we all have better health in Africa. It's my pleasure to welcome the president of the association, Dr. Johnson Adeyanju.
Thank you very much.
And he has come along with Dr. Abraham Oshimbowale, who is chairman, Advocacy Committee of the association.
Thank you very much.
Thank you. Good to see you again.
Thank you.
Now, the new president.
Yes.
Welcome on board.
Thank you so
We
much.
had the pleasure of speaking with him last year.
Yes.
What are the plans under your stewardship?
Very good. You know, AMPA has assisted for the last 22 years, and our vision remains the same: a healthier Nigeria in a healthier world. Because we believe as the world gets healthier, Nigerians should never lag behind. One commonality for all AMPA members that are in USA is one thing: we all have our hearts in Nigeria, and that's why we continue to promote our mission. Our mission under current leadership has expanded. Last year we started just a small form of what we call AMPA Week, and this year we decided to bring a dedicated teams of physicians for both surgical and medical missions. So our AMPA Week that we normally do now consists of 4 entities: the surgical mission, which is headed by Cliff Eke, the chair of our surgical mission team. We also now have a complete dedicated team of professionals for medical mission, and this is a team we call the AMPA Disease Intervention and Prevention Team. Mm-hmm. And that team is involved in a community outreach program that we just started. Another component of our AMPA Week is the advocacy section, which is headed by Dr. Oshimbowale, and that involving liaising with all our healthcare stakeholders, including the National University Commission, the Medical Dental Council of Nigeria, the Federal Ministry of Health, the Nigerian Medical Association, a private partnership, and public hospital in Nigeria. So we work to promote and try to collaborate and partner with all these entities to continue to promote better health in Nigeria.
Dr. Oshimbowale.
Yes.
How large is your mission to Nigeria this year?
This year actually expanded, like the president said, because we wanted to do more, and we wanted to reach every stakeholder, including the teaching hospitals, the specialist hospitals, and also the public. So in terms of capacity building, we were able to expand it more.
Okay.
And we involved the Lagos Island local government this time too, in addition to First Consultants Hospital as our private partner.
Okay, so while your teams are here, because he said that the president has said that there are 4 teams, are you going to run clinics? Are you going to carry out surgeries? What is the nature of the work you're going to be doing?
Yeah,
apart from advocacy, which is your forte?
Absolutely, yeah. And I did join the medical team to see patients. We saw patients in St. Gregory's College as our outreach for the people in Etiosa local government. We saw about 400 patients. And then we went to the Freedom Park to see more people under the auspices of the Lagos Island local government. And we also saw another 200 people. So in 2 days, consulting, right?
Yeah.
We're consulting. We partnered with Junior Chamber International, a group of people under 40 who are all over the country to recruit for us. And they were able to line up enough patients. They went into the community working with the local government people so we could see people. And we saw kids too. We saw children, we saw adults, we saw women. And we covered everything from pediatrics to women issues to surgical issues. While our surgical team were based in Force Consultants operating, and during this time, 2.5 days, they operated on 37 cases. And we were referring cases to them in addition to the cases that were lined up for them in the hospital. So in terms of medical and surgical mission, we accomplished that while we were in Lagos.
Okay, so you were doing both diagnosis and treatment?
Yes. We came with pharmacists too from the U.S.
Okay. Now, the question I want to ask is this mission only focused on Lagos?
No.
Or are you spreading to other parts of the country?
So AMPA actually have two types of mission. What we call AMPA certified mission, in which at any point in time throughout the year, there are physicians of Nigerian origin who go to different places within the country. They are certified. We have directive from the Federal Ministry of Health on what they're supposed to engage in communication with MDCN. So they go to different parts of the country to perform medical missions. That's AMPA certified. AMPA sponsored is this one. AMPA sponsor, it's much involved the executive and part of the board of directors, as well as multiple volunteers. Usually the president of the organization accompanies AMPA sponsor, which is directly sponsored by AMPA. And that entity is now slated to take part in different parts of the country. This year, last year, there was a small section that was in Jos, but it was done in Jos. This year we went out full-blown with a team of almost 20 volunteers that we have. Then when we combine with our local doctors that join us, with Dr. O'Hary and Dr. Osuji from LATSU and Lagos State and some of all the other doctors. Then the ETIOSA also send some doctors to work with us. So when we look at a combination, we're running about 25, 26 physicians working as a combined team, taking medical care to the people and making sure that health and education are provided to them. So as we do this, we plan on doing it in different parts of the country. Jos was last year, Lagos is this year. Next year we're probably going to the east. The year after, we choose.
Okay, so what you do is you based on geographical locations, one location at a time.
Yes.
Per year or?
Per year for the sponsored. For the certified, it's all over the country.
Within that year,
anytime.
Okay. Now, the question, when you're talking about advocacy, you talk about liaising with stakeholder institutions in Nigeria. What's your relationship like with the Nigerian Medical Association?
Very good. As a matter of fact, we just concluded a joint CPD, continuing professional development with them in Calabar. We came back from Calabar yesterday, and we presented stuff, as part of educating Nigerian doctors on cutting-edge things that we do there. And their president comes to our convention, we come to their convention, and we want to develop this relationship further. We have a very healthy relationship, and we're trying to make them model what we have in the U.S., where everybody in the health sector works together, the doctor, the nurse, the pharmacist, the lab tech, instead of the perennial fights that we understand is going on. And apparently it's going to happen because all the heads of their various other professions.
So on behalf of the 170 million of us who are Nigerians, I'd like to say thank you. We do appreciate your effort.
Thank you very much.
And we pray that it expands and covers more and more people. Thank you very much. AMPA President Dr. Johnson Adeyanju and AMPA Chairman Advocacy Committee Dr. Abraham Oshimbowale.
Thank you very much.
And AMPA, by the way, stands for the Association of Nigerian Physicians in the Americas. Thank you very much for coming.
Thank you very much.
Sunrise will return in a short while.